Good morning, everyone. It's 10 o'clock, so we'll get started. Just welcome to everyone that's joined for our first ever webinar for our Best Start in Life community of practice. We have disabled access to microphones, but please put on your cameras. It'd be lovely to see everybody's faces. Any questions can be added into the chat. Myself and Natalie are monitoring those as we progress through the webinar, but there is 10 minutes at the end of the session for any specific Q&As where you'll have the opportunity to put your hand up, etc. And just the session will be recorded and added onto our PSB website afterwards, and everybody will just have an email once they're all uploaded. Thank you, and hand over to Errol. Next slide, please, Tash.
Lovely, thank you, Nisha. Bore pawb. Good morning, everybody. Welcome to the first Best Start in Life Community of Practice webinar. And the focus of this webinar today is understanding the impact of trauma and adversity on child development. So I'm Errol Powell. I'm a public health consultant and Gwent PSB for giving every baby and child in Gwent the best start in life. And I'm delighted to introduce to you the speakers for this morning's webinar. So we're going to start with our guest from Public Health Wales, Natalie Blakeborough, who's going to talk to us about the Adverse Child Experiences, the ACEs Hub Wales, and the Trauma Informed Network. And then following Natalie, we've got two colleagues that are joining us from Blackpool Better Start, Dr. Laura Wolfelden and Rebecca Calvert, who are going to talk to us this morning and share some of their experience and insights on the impact of trauma and adversity on child development. So we've got a really exciting programme of speakers, and we have an opportunity at the end for any questions that you may have. So please do, if you think of questions as we're going through the presentations, please feel free to put them in the chat bar. We will monitor that and pick them up at the end. But you're also very welcome at the end just to come in and ask the question directly. So next slide, please, Tash. I just wanted to take a little bit of time, just a few minutes at the start of this session, just to introduce you to this community of practice, because this is a new development. This is, as I said earlier, this is our first community of practice webinar, and we're really keen to, I suppose, get your support and your input into how we evolve the community of practice. Next slide, please, Tash. You can see what we're hoping to achieve through this community of practice on that slide, but really the idea behind it is that we bring to you in very bite-sized chunks, so webinars of an hour, evidence, policy and practice, and really importantly, lived experience and the voice of babies, children and their families in Best Start in Life. And we're bringing that to you as a group of early years professionals in Gwent. And I think one of the things that we're really keen to do through our Best Start in Life programme is really support and care for those that are caring for and providing health and care for babies, children and young people. And in a context where the needs are ever increasing and more complex, we hope that this will be a really supportive space for professionals to further strengthen and develop their understanding of what helps babies, children and young people and their families to thrive. The emphasis of the community of practice is very much about how we support prevention and early intervention through systems working. So really recognising that if we're to have an impact and to make a difference, we really need to work in that whole systems way. And the community of practice is aligned to Gwent PSB approach, which really emphasises multi-agency working and collaboration. And we're really hoping that through these webinars, we'll encourage space for reflection, for peer discussion, and the value of, I suppose, taking a small window of time to step back from the demands of your busy roles and to invest in your own learning and development and to network and connect with other professionals that are working in this space. Finally, I think the first objective that we have there on this slide is a really important one. And as we shape this community of practice, I'm really, really keen to ensure that we have the voices of babies, children, young people, and that lived experience really coming through our thinking and our development in this space. So just in particular wanted to sort of highlight that. If we can move on to the next slide, please, Tash. Lovely, thank you. So in addition to the webinars, bi-monthly webinars, we've also just published the first edition of our Best Start in Life quarterly newsletter. We really welcome your contribution, your feedback on that first edition, but also your contributions to that as we further develop it and as we look for good practice, for events, resources, updates, opportunities that we feel need to be shared across early years professionals within Gwent. So at this stage, and it's a very early stage of development, those are the two key prongs of our community of practice. That may well evolve as we move on and as we, I suppose, identify particular areas of focus within Best Start in Life where we might need to do a bit more work. But I think the hardest thing sometimes is starting somewhere. So this is very much in the space of starting somewhere, taking feedback and seeing how we can evolve this approach. And most importantly, understanding, whether it's helpful and the difference that it's making in supporting you in your professional roles. So that's a little bit about community of practice. I don't want to take up too much time of our hour today because we need to focus on today's topic. So let's move us on. I'm going to introduce you now to Natalie Blakeborough. She's the Deputy Lead for the ACE Hub Wales programme within Public Health Wales. She specialises in embedding trauma and ACE-informed approaches, and that's included piloting the TRACE toolkit and really helping organisations to support children, families and their staff. So those objectives really closely align to what we're trying to achieve here within Gwent. So delighted, Natalie, that you are able to spend some time with us this morning, and I'm going to hand the virtual mic over to you. There you go.
Oh, thank you, Errol. Hi, everybody. Thanks for having me, first and foremost. It's really lovely to connect with you and see how and your objectives really for your community of practice. And as you say, there's many things that we do at ACE Hub Wales, which I'm sure will benefit both being aware of what the work you're doing, but also some of the tools and resources I'll talk to you a bit about today. My presentation, I do speak fast. I might speed up a little bit more because there's so much to say probably in the next 10 to 15 minutes. I will skip through some slides because I'm not going to talk too much about ACEs in terms of adverse childhood experiences. I think there's a assumption maybe that there's a baseline understanding about what they are, and I know the following presentation after me might put a bit more context in terms of the impact. What I'm going to talk to you about is where we are now as a hub in terms of our focus on that kind of ambition of Wales becoming a trauma-informed nation, and by doing so I think I will talk you through who we are at ACE Hub Wales and the journey we've been on really to get to the point of a Wales-wide framework for embedding trauma-informed practice across Wales. Next slide, please. So who we are, so we're ACE Hub Wales, as Errol pointed out, we are hosted in Public Health Wales, but we are funded by Welsh Government to really, our goal, if you like, and has been since 2017, is to spread awareness around adverse childhood experiences and their potential health harming impacts, but also to share evidence at that kind of national level about what works to prevent and mitigate the impact, importantly, of those who experience those ACEs in childhood. We are a national hub, so we do focus our efforts very much on terms of that kind of systems change around what we can all do and share that knowledge back with professionals to upskill and take that learning as well and share that more widely. We were set up originally to kind of really spread that awareness following the Welsh specific research on adverse childhood experiences and of course building on that international kind of knowledge base around experiencing trauma and adversity in childhood, and then more importantly, what we can all do to prevent the impacts of ACEs. Next slide, please. As I mentioned, I'm not going to go into this in too much detail, but this is just a reminder of the research that I'm talking about from 2015, led by Public Health Wales and Professor Mark Bellis, to really start to understand what adversity and trauma looks like in childhood in terms of the traumatic events, but also then the associated health harming behaviours linked to those who experience ACEs, but more importantly, the cumulative impact of experiencing multiple ACEs in childhood. Next slide, please. Important to say, we continue to focus on a population level in Public Health Wales and with Bangor University on ACEs and the experience of those who experience them. But the ACEs, from our perspective and in all of our messages, are not deterministic. So we certainly don't promote the idea that anybody who experiences 1 or 4 or 8 ACEs will definitely experience the health harming impacts that we talk about. And we promote the kind of understanding that resilience plays a key role in overcoming adversity in childhood. Most of you on the call will be aware of, because you might be one, in terms of the role of a trusted adult in communities and services, and those emotionally reliable kind of relationships and stability for a child or young person, which doesn't need to be a parent or caregiver. It can be a family member, a teacher, sports coach, you name it, but also having those access to resources to manage and equip themselves with managing their emotions and being connected with their communities plays a really strong approach. So we also know that there are many more forms of adversity in childhood than those that are captured within the research. So we absolutely need to think about this in terms of a consistent approach across Wales for children, young people and their families. Next slide, please. A pivotal point for us in ASAB Wales was a Welsh Government policy review in 2021 to understand how far we'd gone with raising awareness around ACEs in Wales, and that came back with us understanding we'd done a lot of research into understanding the scale, not just in policy but in practice, of the awareness of ACEs in services. But actually we needed to do a bit more in terms of promoting the consistent understanding of what that means in terms of using that skills to change practice to help to really mitigate the impact of ACEs. So Welsh Government asked us, with that in mind, to think about a framework for Wales and what that would look like. And I'm going to play a short animation just to kind of set the scene, and I'll talk to you a little bit about what the framework means in more depth afterwards, if that's okay. Next slide, please. After eBay.
Key to talk about, whether it's something you're experiencing personally or it's happening to someone close to you. Imagine going through a difficult experience that leaves a lasting impact on your mental and emotional well-being. It's left you feeling overwhelmed, anxious and unable to cope. This is what trauma can do to a person, and it's more common than you may think. So, how can we help those who have experienced it? That's where the Trauma-Informed Wales framework comes in. It aims to create a more coherent and consistent approach to how support is developed and used across Wales, providing the best possible care for those who need it. There are some key principles that can help us do this, such as working with the person to help them feel safe and supported, creating a sense of trust and transparency, as well as considering any cultural, historical, or gender-based issues. This framework represents the different types of support a person dealing with trauma may experience. In a wider sense, this involves improving everyone's understanding of adversity and trauma by emphasising the role we all play in creating a trauma-aware society. A trauma-skilled approach offers greater insight to anyone providing care or support for people with traumatic experiences. A trauma-enhanced practice informs frontline workers who are directly supporting the recovery of those with traumatic experiences by giving them the tools they need to help people cope. And for individuals who require more intensive care, there are specialist interventions, which are a more personalised form of support and are often tailored to the needs of each person. Through the Trauma-Informed Wales Practice Framework, individuals, communities and systems will gain a deeper understanding of their vital role in helping support those with trauma.
Thank you. That was just put in to break up my talking, to be honest with you, and it's a really nice resource for us to share what is, I guess, a large document, the traditional kind of framework document, into something that's a bit more accessible for people to understand in a short animation. If we could go back to my presentation, I will just talk you through that in a bit more detail in terms of what that might mean for you, in terms of your network and your individual organisations. It's not coming up on my screen. Am I lagging? No.
Give me a second, sorry.
That's okay. No, it's okay. I can keep talking. That's fine. As I said before the animation, Welsh Government asked us to think about what a framework for Wales would look like, and we partnered with our co-leads, Traumatic Stress Wales, which some of you might be familiar with, who are an organisation who very much sit in the specialist end of understanding trauma and the specific interventions that support people who have experienced trauma and need that more specialised support. And we came together with an expert reference group across Wales of third sector organisations, academic partners, people working in the field, but also people with lived experience, to think about what is it for Wales that we need if we're going to bring that consistency and coherence to what trauma-informed practice needs to be across not just one sector or one individual, but across that system, that will bring about the real change. Next slide, please. So in terms of the framework, it felt really important that, taking inspiration from all the different definitions that you can find around trauma-informed approaches and trauma-informed practice, that a definition for Wales was formed. Now, appreciating this is a very large definition, but it was developed, as I said, with the expert reference group and with a consultation period as well. And it was felt that not one component of the definition could be removed, and that every single part of it meant something for us, for Wales. And at the heart of it, it just recognising that everybody has a role in kind of creating opportunities for life chances and for people affected by trauma and adversity, and that it takes account of the widespread impact of adversity and trauma. And importantly, this isn't just about a service that we provide to people who've experienced trauma, but it's also about our communities, it's about our staff, and it's about people who show up to work every single day to understand the impact that can have, not just on the nature of the work that they're doing, but also that they come as humans themselves with their own experiences, and that actually a workplace response is really pivotal to the recovery from whatever they've experienced. And more importantly as well, to support that, we know that training alone isn't effective, and that a trauma-informed approach needs to be embedded more widely into policies and procedures, that takes a real commitment to actively kind of preventing and resisting re-traumatisation. So a lengthy definition for Wales, but one that we continue to reflect on and think about if that's something that we, you know, it is still really important for us, and there's been no way, no matter what we've done, of reducing that. So I won't read it all, but hopefully you'll have the slides afterwards, and I'll send a link in the chat as well for the actual framework. If you can go to the next slide, please. Alongside the definition, it's really important to think about, so what does that mean in terms of definition? What does that mean for us all, both as individuals, but also for the organisations and systems that we work within? So alongside that definition, we have a set of 5 practice principles and 4 practice levels. And this really starts to put into kind of words and kind of practice and kind of competencies, if you like, to think about what it is that underpins all of the practice that we expect to see across Wales to take a trauma-informed approach. So they won't come as any surprise to most on the call, I'm sure. They know they took inspiration from many models across the UK and globally in terms of trauma-informed practice principles. But they are a universal approach that does no harm, being person-centred, relationship-focused, resilience and strengths-focused, and really importantly, inclusive, which really recognises that the impact of diversity, discrimination and racism, and understands the impact of cultural, historical and gender inequalities across the societies in Wales. So it felt really, really important, alongside some of the other national priorities that we have in terms of understanding what a trauma-informed approach looks like for kind of gender equality, for an anti-racist Wales, etc., etc. In the concentric circles there on the right-hand side, this is just our visual way of showing that for us, trauma-informed wasn't a practice level, but it encompasses all of the kind of practice levels that we are talking about. We know that there are many people within one organisation who practice at different levels and will have different kind of knowledge and skills needs for whoever they're working with in their organisation. So starting very much from a trauma-aware space, that's the kind of land that ASAB Wales sits in terms of raising awareness across that whole organisation and whole of society approach, and what does everybody need to know about trauma and adversity, and how it's rooted most simply in kindness and compassion across those organisations. Going through the practice level, then through to trauma skill, trauma enhance, and right through to specialist interventions. It was designed in a concentric circle way to recognise that any one person will be accessing multiple services at one time, and that actually that importance of that kind of consistent approach wherever they may be seeking support is really, really important. And it's not just down to one organisation to hold that in a trauma-informed way whilst, for instance, they may be waiting for more specialist interventions. Next slide, please. This is just a definition breaking down those practice levels. This is within the framework that I'll pop a link to in the chat, but it's just to really recognise that hopefully all of you on the call will be able to locate which practice level you could be working at. And then it's about matching the needs within your organisation for the appropriate training level that you might need to think about. I'll skip over that one now, thank you. And then lastly, I'm just going to talk to you a bit about, within the definition, we looked at how organisations can take that role to thinking about embedding trauma-informed practice across their organisation in policies and procedures, etc. And within the framework, we have our trauma and ACE-informed organisational toolkit, which is very much a culture change programme for any organisation who is seeking to embed trauma-informed practice in the very fibre of their kind of organisation. It's a 4-stage process, and it's very much about celebrating existing practice. And that feels really important to say, because we know trauma-informed practice and ACE-aware practice is not new to many, many organisations. And actually, this is just something that can help to really celebrate and build onto and continue that kind of reflective process of continuous improvement, really, in terms of trauma and ACE-informed practice. It's certainly not a tick box exercise. It's designed to be a reflective, strengths-based exercise for organisations to go under and really think about that self-assessment. As I said, identifying really strong practice that exists already and really celebrating that with your teams. And in doing so, naturally, there will always be opportunities to think about strengthening and building an action plan to take forward some of those changes that you seek to kind of make. And of course, all the way through that, continuous monitoring, evaluation and review is encouraged to make sure that impact is kind of understood from the outset, so that when you're looking to sustain approach, you always need to know that you can reflect and think the efforts that you've put in have made some significant changes and important changes. The Trace Toolkit is not just one tool. There's multiple tools in there across each of the domain areas to really help organisations to think about this. And if we go on to the next slide, this one just outlines what the toolkit looks into across the 6 domain areas. So it's, as I said earlier, in terms of trauma-informed practice, I think the go-to is always, we will train our staff in trauma-informed approaches, and that's just the beginning, is what we say. It's a very important part in terms of upskilling staff members, but the organisation needs to be in a place to accept any changes that need to be made because of new knowledge around trauma-informed practice, and the whole infrastructure of the organisation needs to be in a position to accept that. So we absolutely know that leadership buy-in is crucial. So this isn't just about individuals within an organisation taking forward changes that can have a massive impact in terms of burden on an individual's shoulders for trying to create change. But actually the governance and leadership of that organisation is integral to kind of making that statement of commitment and intent to go through this formal process, if you like. And of course, then policies and procedures need to update with changes in terms of understanding and placing the principles of trauma-informed practice within those policies and procedures, in terms of not just, as we've talked about, being providing a support service to those who access your service, but understanding how that impacts your staff procedures and policies also. Of course, workforce training I've talked a bit about, but what's really important is the support there for staff as well, in terms of not just through putting on training. It's about the support that wraps around that individual and team within an organisation, not just in terms of supervision and caseload management, but active reflective practice. So having a culture that really accepts reflective practice is really key, which all of this work around, the toolkit promotes. We look at physical environment, recognising the role that the actual physical environment has on people who are accessing your service, but also for staff as well, in terms of the environment that they work within. And then the last two there around service design and delivery and monitoring and evaluation are about that sustainability. How is this approach built into plans for change, funding, bids, everything that you plan for a service to really start to embed this approach as well. We have a range of tools. We've got different guidance on how to look at policies and procedures in a trauma-informed way. We've got animations about what, and guidance and walkthrough tools about what it feels like for the physical environment. How do you embed the principles in the physical environment? So I'll pop links in the chat as well around some of these. And the next slide just brings it all together in terms of understanding who we're working with. So, of course, we have said throughout this presentation, this isn't just the responsibility of one organisation or one sector, and it feels like sometimes the burden is on a specific kind of sector to do that. But we worked for a number of years with the Trace Toolkit with education as an example, both primary, secondary, alternative education, further education, higher education, just to recognise that whole education journey and the differing needs at different points of that journey for those students and learners. We've also done a lot of work with homelessness and housing and substance use, who have always led the way in terms of a trauma-informed approach. But we've worked with those organisations, and they've been part of our evaluations for understanding how the toolkit has helped to support to embed some of that. And then most recently, in the last 12 to 18 months, we've been doing a focused piece of work with the criminal justice system, which feels really, really important in terms of not just youth services, but all for police forces, HMPPS and HMCTS, and also with health. So we're very kind of early in our kind of journey with health boards to work out how this can start to be collated in terms of understanding the scope of the work so far. And it sounds like having networks like this one itself is a very strong example of how you connect that up as well. So I think that's it for my slides. I'm not sure if I've gone over. Apologies if I have. It is very much a whistle-stop tour. So there's lots more that I can go into. But if there's any chat questions, I'll happily take them. But also there's my email address there, should you wish to kind of reach out to me if the Trace Toolkit or any of the resources we have would be of any benefit to you individually, but organisationally also. So I'll stop there.
Lovely. Thank you ever so much, Natalie. Diolch yn fawr. Brilliant. You've covered so much ground there, and if we were in the room, there would be a big round of applause now, I'm sure. So yeah, just to say a huge thanks on that. Some really key take-home messages for me. A really important one at the start there about understanding the importance of resilience and preventing ACEs, and not falling into the trap of seeing ACEs as being deterministic. Quite a kind of key message there. Another key message in terms of, I suppose, the approach, and not overly relying on the training of staff and awareness raising, but really understanding the role that leaders play within this space, how this is embedded into organisations and teams' policies and practice, and how there's sort of follow-up support and supervision and reflective practice for staff that are really working in this space. So some really useful messages there. And I have to say, some really great tools for organisations, services and teams to use. So we will follow up by sharing those tools. For me, I think it's always really helpful to have a video that just starts with the basics that you can sort of share, that demystifies what can sometimes be a slightly daunting topic when you're thinking about trauma and adversity. And some of the videos that have been produced, I think, are excellent in doing that and providing that sort of introduction to. So really commend all of those to you. We'll take questions at the end. Thank you ever so much again, Natalie. I'm now going to move us on to introduce colleagues from Gwent Best Start. So Really pleased to have with us Rebecca Calvert. Rebecca is an experienced consultant specialising in system change, early child development and trauma-informed practice. Rebecca is accompanied by Dr. Laura Wolfenden, expert in mental health, health behaviours and system level change. So croeso, very warm welcome from Wales. Excellent to be able to hear what's happening in England and to learn from some of your practice and your approach. So without further ado, I'm going to hand the virtual mic over to Lauren and to Rebecca.
Thank you.
Is my screen sharing with you?
It stopped now.
It's gone
Was
now.
for a minute and it's just flicked back. So we'll give you another minute to
Full.
bring it up.
Let's try again. Let's see.
I wish I'd been on your presentation before. It sounded really interesting. Thank you.
Yeah, it was fantastic. Yeah, thank you for that. I wish we would have come on earlier. Yeah. It sounds like there's so much learning that we can probably really think about how that relates to so much of what we're going to talk about today as well. So thank you. Thank you for that and letting us come on a little bit earlier as well.
We can see your slides.
Super. Okay.
Thank you.
So kind of similar to what the person before us just said, we are going to give you a very quick whistle-stop tour. I'm conscious we've not got much time today. So if anyone does have any questions or wants any further information about anything that we just touch on that we're not going to go through, please feel free to get in touch. We're more than happy to share any information that we can with you and any resources. So today we're just going to touch on a little bit about kind of Better Start, give you that understanding as to who we are and how this has led to our work around trauma and trauma-informed approaches with a wide range of workforces, and how we're bringing these workforces together and these organisations together to really look at how we can together collectively mitigate the impact of trauma and really look at how we can build resilience within that. So really briefly, I am not going to spend a long time on this. Better Start, we are a team of early child development experts with a real shared vision around how we can change childhoods from pregnancy through to starting school, really looking at how we have a bespoke approach that looks at how we can keep infant voices at the heart of what we do, how we can look at transforming and working with local services, bringing people and those with lived experience together, as well as senior leadership teams. And really the core of that is then we put a lot of that research into action. So we had, over the last 10 years, we've had £45 million to look at how we can use this. So using implementation science to have a test and learn approach, which is what we kind of use this language all of the time. We are so lucky that we've been able to not plug gaps in other bits of funding, but really look at how we can work with agencies and organisations to look at what research or what evidence we need to gather to really improve the lives of children and families across the town. To do this has meant that we've had a really strong partnership approach that's been completely community-led every step of the way, with community panels, community voice, lived experience groups, lots and lots of things across a span of services that we have, as well as bringing that together. And it's also meant that we've been able to bring senior leadership teams through our governance boards together to be able to look at how we integrate our learning locally with regional partners across ICBs, across NHS, etc., to really look at how we can use this fantastic gift that we have of having this test and learn approach to be able to support that in other areas, to really reduce that and interrupt that intergenerational cycle of poor outcomes. And we're going to cover this a little bit more in a minute, but what this has meant is having this trauma-informed approach through our approach. It's meant that from speech and language through to diet, nutrition and social and emotional development outcomes, we have an approach that is really driven by the community, where we're hearing what they need, why do they need it, why does this matter, why do you not engage with services, and what does this need to look like from that change perspective. So an example I wanted to share with you that we really try to kind of hone in on when we're thinking about this approach is this concept through to sustainability. What do we need kind of every step of the way? What is the core underpinning of what we need to do? Why does that matter? And it really does span from families and communities through to how we co-produce resources, how we collaborate at every step of the way, and how we're able to take things like core UK government priorities, link that with our local priorities to get that buy-in, that accountability, and really have that investment for what we're trying to do. So we're able to then take that concept that might be partially data-driven, partially lived experience-driven, to really think about what is available based on what people are telling us, what's working, what isn't, how can we change our approach to implementation. And we're really fortunate to have an in-house research and evaluation team so that we can ensure that we have that monitoring and that evaluation in every step of the way of what we're doing. And then our management structure then supports the sustainability through our governance boards to look at how we ensure, even through our boards, we have lived experience representation through that and with their voice and their experiences, to make sure that collectively then we're able to look at how we can ensure that scalability and sustainability of particular approaches. And what that has meant is that naturally we've been able to look at how from pregnancy through to schools, we've been able to, every service that a parent would come into contact with, we've had the golden thread of trauma and trauma-informed approaches weaved in through. So Rebecca's going to just quickly talk through a little bit of what this has looked like as a whole, and then we'll go into a bit more around the trauma side.
So when we're thinking about the cumulative impact within Blackpool, we're really proud of the work that we've done. We've got community connectors that have seen 15,000 of our families and children. They've supported 4,500 parents of 0 to 4-year-olds. That's not been an easy task. It's something we've worked really hard to develop those relationships within our communities and between our communities and our services. We've got 75 different projects funded, and we've supported and delivered 50,000 lots of training to 27,000 individuals. Most of our training in Blackpool is face-to-face, to be honest. We do some e-learning, but we find that the training that's face-to-face is much more impactful. 10,000 children have attended our events, and 1,000 events have been chosen by families. So we're really involved in our families choosing what they want us to do and what they want to see. 47% of pregnant women have attended our events, and 78% of children of 0 to 3 have been reached. When we're thinking about community development, we want to think about the 4 key branches. So this is a trauma-informed, place-based approach that we've used. So community development has involved our communities in listening to what they want and what they want our professionals to do. We've reframed the language that we use, the infrastructure that we use, the documentation, the leaflets that we give out. We've listened to everything that they want to say around everything that we develop. We've reframed how we talk about child development using the Frameworks Institute to help us, but we've also reframed the literature by simple things, pictures of families. Do they represent our communities? They were telling us that they didn't. The language that we were using, they didn't really understand. So we've gone completely back to basics around things. We've transformed our workforce by involving our workforce, like you've said, good governance, but actually sitting down with our health visitors, midwives, looking at how we want to change our systems together, but also listening to our families and children and listening to what they say we need to do as professionals within our services to make that transformation more impactful. We've looked at our universal services. Blackpool's a really difficult place to work. Our families are quite transient. We really needed to get into those homes, but we want those people to feel that they can engage with us. We want our services to meet their individual needs. So our health visiting service, for example, wasn't good enough, let's say. So the core programme of visits in health visiting is 5 across the UK. Our families get a minimum of 8 contacts. So we've got an extended, enhanced service. We've also looked at the tools within that service. Are they easy to understand? Have our professionals had the training to use those tools, like the ACEs questionnaire, mental health assessment, domestic abuse assessments? We want to be able to prevent adverse childhood experiences. But ultimately, when our families are suffering from adversity, we want to be able to identify that as quickly as possible and put our services bespoke for their needs in place to try and stop the mitigation of that. We've also got lots of targeted and specialist services in Blackpool that we're proud of. So we've got specialist services around infant mental health, adult mental health, attachment and attunement, early identification of domestic abuse in pregnancy. So for BSiL, we've got video interactive guidance to try and improve attachment and attunement. Every thread of the work that we do is trauma informed to try and improve the outcomes of those people that are suffering from adversity, but ultimately prevent it. Workforce training and development is something that I'm really proud of. So we've trained 20,000 people within Blackpool. Originally, we were targeting the direct workforce, the workforce that are working in Blackpool, but actually that was short-sighted. So we then extended our vision to look at the workforce of our future. So our future workforce that are coming into professions like health visiting, midwifery, early years settings, hub settings, mental health work or social work, etc. Volunteers, community members are all receiving trauma-informed training within their training modules within universities and colleges. And that's from sixth form colleges and through to level 5, 6 within our universities. So we're embedding the work across, we're threading that work across every element where it's possible so that our future workforce are trauma informed. Our direct workforce has been working closely with our health visitors, midwives, police, probation staff, early years settings, GPs, dentists, everybody and anybody that comes in contact with children and families so that we can support them to become more trauma informed. But actually the important thing around that is to become trauma responsive. So informed's okay, but unless we actually change our practice and treat our clients as individuals and address their needs, it's not going to work, is it? So we've looked at this in early years, we've addressed it in infant feeding, we've looked at attachment and attunement, we've looked at oral health in Blackpool. We're becoming trauma aware in every setting and at every environment. It's within our development of training around core child health and development, and we thread that through our training. So we've got trauma training, but we've also got different elements of that include the brain architecture game, and I'm sure that you all know about the brain story certification from Alberta. We've also been targeting specific areas, so male mental health and really engaging with dads. Inclusivity is really important, capturing the voice of our parents, but also capturing the voice of our child at every opportunity. We're not only engaging with people, but they're part of every service that we develop. They're on our interview panels, we're listening to what they say, we're listening at how we need to improve our services. Sorry, I've lost my thread then. So when we're becoming responsive and trauma informed, we notice the organisational shift and the organisational change. We notice our settings are more inclusive, but also we notice that from the minute you step into those environments, people are friendly, they're welcoming, they're kind. Lots of our clients really struggle to enter our environments, our professional settings, or even community settings like libraries, etc. So we've been vastly involved in inclusivity around our parents and changing those services and settings as much as we possibly can. Within all this workforce training and development, we've also been looking at sustainability. So how are we going to make this more impactful? How are we going to make this ripple effect really work across our town, but also wider afield? And that's why we've been focusing with our professionals, our future workforce, around things like pathways into social work, health visiting, midwifery, public services, etc. And we've been doing some train the trainer work around the brain game. And originally, if I'm honest, we're only a small town, but with a huge heart. We thought we'd get around 10 people to do train the trainer for the brain game, but we're celebrating almost 100 people now that have done that. And if you don't know about the brain architecture game, come and join us, because we're quite good at that now, having delivered it to about 5,000 people. And it's a really good tool to embed all those messages around diverse childhood experiences and the impact of those, and how we can also make sure that we offer those strengthening support opportunities to our children and families.
And just to really quickly add to that before we move on to the next slide, I think we've got here, you can see around our core offer, infant feeding, oral health, all of our approaches of, as Rebecca said, every member of the workforce who would come into contact with children or families, we tried to ensure that we use our community connector model, which is it's almost like a peer support model, but it's members of the community who are paid employees who work in the community, really listening to what people are saying. They support them to access services. So that includes places like oral health, that includes coming along to some of our infant feeding sessions, we then were able to, from using this approach, this initial concept to this sustainability, we have a really solid antenatal offer in our town that's reasonably well accessed from first-time families. But the antenatal offer that we have, for those who come onto this and are supported by our community connectors, we actually see they are much more likely to breastfeed, they're much more likely to access dental surgeries, and then in turn we see a reduction in dental caries for our under fives, for example. So that kind of holistic approach is what we are, we're really hoping that we kind of get across today. So if anyone has kind of any more kind of questions around different aspects of it, please do let us know. Back over to you, Rebecca.
Thank you. So here we've got trauma connections, and you've had quite an extensive session prior to ours on ACEs, I believe. I heard a little bit of it and it sounded fantastic. But on the left, we've got the adverse childhood experiences that we frequently talk about, and we're focusing on those. But actually on the right, we've got the complex trauma. When we're thinking about the complex trauma, this is prolonged, frequent exposure to traumatic incidences and episodes. Often our children and families have got little time to recover, so we know that this not only affects their mental health, their physical health and their psychological well-being, we also know that actually it sometimes can have long lasting effects, and we can see that with our self-soothing techniques that we see within our hospitals, can't we? So very high levels of self-harm, very high levels of substance abuse, alcohol abuse, gambling, addictive behaviours, anything that's going to raise that cortisol and give you that self-soothing instant impact. Sadly, a lot of this type of trauma goes on in secrecy, and the prolonged effect on our children can lead to other things as well. So we can see quite frequently we've got low education attainment, high social need, poverty, deprivation, and the ongoing mental health effects of this type of trauma is something that we are really trying to work at, firstly identifying with our ACEs questionnaire, but also with our kindness and compassion and our approaches to everything that we do. When we're thinking about trauma informed as well, we're using the 4 R's, which I'm sure you know about as well. So we're first of all realising the widespread impact of trauma and understanding the potential pathways of recovery is really important. So realising it isn't just about the adverse childhood experience questionnaire, it's also sitting down and talking and developing those professional relationships with our families and trust and safety. And just being curious, maybe changing our language, asking people what's happened to them rather than thinking about their behaviours in a different way. When we're thinking about recognising the signs and symptoms of trauma in our clients and families, quite often we can recognise the signs and symptoms when we're looking at our attendance rates for our appointments, etc. Why are people not accessing our services? Why is there a reluctance to trust us? Why is it difficult? Or why do we think people find it difficult to engage with us? And I hate to see that there's been poor engagement or non-engagement written in records. I like to see things like, Sarah's not found a way to trust me yet. And we want tenacious, inquisitive staff, don't we? So recognising the impact of trauma is really important. We want to respond fully, so responding with our integrated knowledge about trauma into our policies, procedures and practice, not just like somebody said in the presentation before, it's not a tick box, it's a personal response that can really make a difference, and making sure that our policies reflect that. And we've been doing a lot of work, Lauren and I, in our local schools and also in maternity services, looking at our policies and looking at whether they are trauma informed. Are we if a child's referred to a CAMS service after 2 non-attendances, are they discharged, or are we responding to them in a way where actually they may feel safe to discharge? So that's just one example. We want to resist re-traumatisation as well. We should be reading our records, knowing our clients where possible, but also not asking all the questions within our assessment tools straight away. Developing that trusting rapport, making people feel safe, can really make people feel that they can engage with us. And that resisting re-traumatisation cannot be underestimated, because the longer you take to actually make somebody feel safe and then trust you, the more likely they're going to engage with us, and the less likely we're going to have this revolving door pathway within our services, and people are not having a chance to recover. So there's some of the examples of the 4 R's that we use and becoming trauma informed in the services that we're using. When we're talking about workforce development as well, we've had quite a lot on offer. So we've had a core Better Start messages. So that's all around early child development. And that's usually an hour online. That's a short synopsis of what we offer within Blackpool to all our professionals. It tells them what we're doing, how we're doing it, what services we've got to support people that they're visiting, and how we can all work together. The second element is the trauma awareness and resilience. So we offer between 2 and 4 hours of training on trauma awareness and resilience, followed by the brain game, which is a 2-hour session of where we look at adversity and trauma using pipe cleaners and straws, which sounds pretty boring, but actually it's fantastic. After that, we've got the bespoke trauma-informed training. So Lauren was going to talk a little bit later about this bespoke training that we've had on offer across schools in Blackpool and Lancashire, and also trauma-informed training around maternity and midwifery services. And the organisational support is a bit like what was discussed before, so looking at policies, procedures, readiness, and guiding people through the organisational change that's needed to make organisations responsive.
Thank you for that, Rebecca. So really quickly then, what we just want to kind of touch on are some examples of the work that we've done. So we often use, from that course, the sustainability model that we mentioned at the very beginning, we often use appreciative inquiry, so the 4Ds, to really highlight the kind of core key principles and opportunities to be able to celebrate what's working well in different services, generating that senior leadership buy-in. But the 4Ds is a really great way of looking at how we can begin to think about the concept through to kind of embedding this within services. So we've had this approach within, health visiting, where we've been able to look at how we can embed adverse childhood experiences conversations as part of every single antenatal visit, which is now part of routine practice, which was incredibly difficult a couple of years. And actually what we were able to do to get them on board to be able to do this and want to do this in practice, it was by showing them the evidence of the very, very kind of strong evaluations that we put in place to show the impact that this was having for our women who were taking part in this. And when they heard this and were able to really recognise what this looked like, we could then support them around conversational toolkits and clinical skills sessions that are now part of their routine practice. They're embedded not only as part of their supervision structure and peer support networks that we've put in place, but we're now able to ensure that we can track and understand what's not working well through that community of practice. And really quickly, just to mention the National Guide for Maternity and Perinatal Mental Health Services work that we did, that led to the development of trauma-informed maternity and perinatal mental health services training across the ICB, where we were able to really think about how we can take the approach around appreciative inquiry, this organisational readiness and assessment, and embed that evaluation in to really look at what difference by having this training, looking at how we can change culture and how leadership and really embed that change in services and practice, what difference could that make? And we were able to see that impact, that lasting impact that is still ongoing and it's still forever changing, but we're able to support the ICB in different places to be able to look at how we can constantly embed this as good practice, as standard practice and as standard approaches, but being able to also identify where those areas around the physical or psychological space, or being able to think about how we can hear the voices and experiences of those who felt traumatized by services. How can we embed that better and differently? And I'll finish up with that. Sorry, I think that's probably our time.
Thank you ever so much. So much ground that you've kind of covered there. I hope you didn't feel too rushed at the end there. I mean, where do we start? You know, we're not at all envious of the investment that you have had for Blackpool. Just to acknowledge that, but you know, really we are keen to sort of learn from that sort of test and learn approach, and some really important themes, I think, coming through the way in which you've worked Better Start in Blackpool, and probably not least that approach to putting the community at the centre of it and ensuring that co-production is sort of central to what you do. But in addition to that, how you've sort of used that trauma-informed approach as another golden theme that appears to be running through all of the work that you're doing. And it was really nice to see how some of that was sort of then reflected through into things like record keeping, and that I suppose the way in which we may interpret things like non-attendance for a clinical appointment, and the framing and the narrative around that, and the absolute critical importance of the relationship and building the trust in the relationship in order to gain the engagement and the trust in that service. So so impressed with that work. I'm going to pause there. I'm not going to say any more, and I'm going to ask whether we have any questions from the audience, please. And please don't be shy. I know sometimes when I feel it's a large audience, lots of people on the screen that you may not know, but really, you really are part of a friendly group here. So welcome any questions that colleagues may have. Let's just pause. Adam, first of all, Gemma. I'll go to Gemma first.
Just got in before me.
Yes, I'll go to Gemma first and then to Adam. Gemma.
Thanks, Errol. Snuck in there, Adam. Sorry. Thank you for the presentations. It was really fascinating to hear, and just, very inspirational, your work. One of the things I noticed was 12 years investment, which is fabulous in terms of being able to really embed and make those differences. I was just really interested in hearing you guys talk about, where did you start? Where did you begin?
Yeah, really, really great question, Gemma.
Yeah, honestly, with the community. I know that sounds really lame, like such a lame response, but genuinely just having lots and lots of open spaces where, we'd put kind of like bacon sandwiches out in the street with a big tent, and had big boards like, what matters to you? What do we need to do? We're getting all of this money, an investment. They also, lots of members of the community also helped us write the initial bid. So I feel like that was a really key part of that as well. And actually, some of those people who were part of that 12 years ago, well, 10 years ago now, actually become our community connectors. So they were members of the community, they volunteered for a long time, and then we were able to have part of this investment to begin to establish the community connector model. And I think keeping that, being consistent with that was really important. But what that doesn't do, we know that that's vital, but what it doesn't do is ensure that we, how does that matter to senior leaders in different organisations? How can we work with them at this very, very beginning point to recognise this is important, this way of working, this way of kind of embedding this different type of approach to practice? What does this need to look like, and how can we think about it? And actually, I would say by establishing the various governance boards that we have, where senior leaders from all organisations are part of those boards. So we have executive leadership boards. We also then have, so people feel very included. They're a part of that. They have to sign off our papers or our concepts. That's based on our learning or data insight. But we then also have operational partnership boards. So anybody who is kind of on the ground, service managers, etc., who really are the ones who might actually be able to counteract some of what we think needs to kind of be done next based on our learning. And then alongside that, everything that we then do goes to our parent panels, parent and carer panels, or parent sip and share sessions, where they can say, oh, that means nothing to me. Why would I want that? Or they can tell us otherwise, So it's a very complex way of working, and it takes a long time, therefore, to do anything. But what it means is that it's very purposeful, very meaningful.
I think from my point of view, so when I started, I was actually seconded from the NHS. I worked as a named nurse for safeguarding, so I was seconded into Better Start. My colleague, a police officer, was seconded in. We then were trained to be trainers. Then we developed training packages with the experts. So I think Lauren's right. For me, the overarching push from a professional point of view was having that professional leadership at a governance level. So if I struggled in health to access midwifery services to do training or dental or whatever, I would go to the lead within the organisation and say, I need some help with this. The person from the police would do the same. We had social care buy-in, education buy-in. So every member of the team had somebody to go to, and we were also involved with the parents every step of the way and the community every step of the way. And our teams are from that community, so we've got the lived experience of living in these towns. That can make a big difference as well, because we can actually access the services from our expert knowledge and our professional experiences.
Thank you. We've got time for, I think, just one more question, so I'll go to Adam next.
Oh, thank you. Yeah, first of all, thank you. It's it's really fascinating presentation and a great example of that sort of advanced upstream working and involving stakeholders from every level. I just wanted to know, actually, will this be recorded, or was it recorded?
It
So that
has
we
been,
can...
yes, it has been recorded, and we will share afterwards. Yes.
Yeah, I think that's great, because there are so many more people that that need to hear about this, and we can increase that interest then and buy in. So yeah, thank you.
I suppose what we've not said, Lauren, is the work that we're doing in Blackpool. You're right, we had a lot of money, and it's been over a long period of time. And what's worked really well, and what's not worked, we've stopped, and we've had a new project take over that. We've not worked in silos. We've been able to make those constant changes, which is a luxury, but it's what we all want to do. And now we're looking at sustainability. Lauren and I and the rest of the team are looking at what have we learned in Blackpool, how can we pick this up and embed it in other areas, how can we support other areas in making these changes and not going back the 10 years that we've done, not make the mistakes perhaps that we've made. So celebrate the learning and see if it can actually be replicated across the UK will be a fantastic legacy for Better Start, and that's from a health worker, and I'm sure that every other professional that's been involved in it feels exactly the same. It's been an exciting project, to be honest, a true public health project, that's for sure.
Thank you. So on that note, just to thank you ever so much, Rebecca. And we are definitely in that space of looking. Gwent is definitely in that space of looking to learn from your experience and what we might be able to sort of replicate and instigate and learn from for the benefit of our citizens. So we've come to the end of this first webinar. Thank you ever so much for your participation. I just want to say a huge thanks to Natalie, to Lauren, and to Rebecca for their excellent, really clear talks. I know the time is tight. It's deliberately only an hour so that we can get as much participation as possible. Just want to say thanks to my colleagues in the public health team, in particular Nisha, Natalie, Tash and Millie, for organising this first webinar. We will plan another one for April, so please do look out for that. And for those of you that haven't joined that community of practice, just encourage you to sign up to that, because that's where you'll see further information about subsequent webinars. So that just leaves me to say diolch yn fawr iawn, have a good rest of the day, and take care. Bye bye.
Thank you. Bye.
Thank you.
Thank you.
Thanks,
Bye.
Bye.
Thanks all.